if it's going to improve and realize intended targets. To give us a view of some of the areas that need to be looked into as far as the health sector is concerned is former Deputy Health Minister and Surgeon Dr. Edwin Muguti. Welcome you to Good Morning Zimbabwe, Dr. Muguti.
Thank you very much and good morning to you. Thank you for inviting me.
Good morning. From your own assessment, what is the current state of the local health sector?
I think our health sector is struggling. There's a lot that needs to be done to improve the health service delivery in the country at the moment. There are many problems, especially concerning availability of manpower, equipment, the availability and distribution of drugs and medicines, especially in the rural areas and the resettlement areas. There is a lot of attention that is also required in terms of the supervision of the different health institutions in the country, be it in the public sector, mission hospitals, and also there's a lot of coordination between the private health sector and the public health sector. So there's a lot that needs to be done to improve our health service delivery system. Funding is also not adequate.
Okay.
And remuneration and morale of our health personnel is very low.
And concerns have also been raised over the lack of transparency regarding the use of the health service fund. In your view, Dr. Muguti, what consequence does this fund have on local health service delivery?
Well, the health service fund was meant to improve the management of individual health institutions so that the institution does not have to be dependent on the fiscus too much. So they're supposed to recoup money from the services that they render. But like any health fund, you need, like any fund, you need transparency in terms of how you utilize. If you allocate the resources inappropriately, if there are a lot of leakages in the system, then you have a problem. So that needs to be looked into. Regular audits must be done to make sure that the money that is collected is actually utilized for the intended purpose.
Earlier on, you mentioned that there is the shortage of the hospital staff, obsolete equipment in hospitals, low remuneration for medical personnel, and unavailability of drugs also on the local service delivery. What bearing does this have?
It has a negative bearing because you see, all those elements that I mentioned earlier, among others, are actually essential for an efficient health delivery system. If your staff levels are inadequate, it means that patient to medical worker ratio is negative. That's where you find long queues, people waiting for services. The staff also undergo what we call a burnout, whereby they are overwhelmed by the numbers of patients that need to be attended to. So the whole system needs to be improved so that you have enough staff, enough equipment, enough remuneration for the staff so that they're happy and not complaining too much. And also there's the issue of maldistribution of health workers as well. If you look at the Zimbabwean the demographics, most of our people live in the rural areas. Most of the health workers are in the urban areas. So that needs to be attended to. We need to put attractive incentives for health workers so that they are happy to work in the rural areas. And also we need more institutions, especially in urban areas, more district hospitals, more polyclinics, which are adequately funded and also adequately equipped. Because right now, most of our polyclinics here in Harare, for example, they don't even do basic things like laboratory tests, x-rays. Everybody has to go to Harare Hospital or Paranatta Hospital. So that congests the system. So it's very inefficient. Yeah.
And I was looking at medical personnel. We do have nurses that have been trained. Still, they're not being able to be part of the main health delivery system right now.
Yes.
So now, what needs to be done? Obviously, it's an issue of finances.
Yeah, finances is a big issue. If you employ them, you need to be able to pay them, isn't it?
Yeah.
Yeah. At the same time, I think it should be possible to employ all the nurses, especially given the shortages that we have in various institutions. We have a serious shortage of nurses in all institutions, really. So I think it's a question of prioritization. Where do we put our priorities? If we decide today that it is crucial to prioritize health, I think we should be able to absorb all the nurses that we have. Yeah, because a lot of institutions actually, they don't have adequate nurses.
And then finally, what are your other recommendations regarding the revival of the local health sector?
I think the system needs to be overhauled. We need greater supervision by responsible authorities to make sure that funds that are allocated are utilized for the intended purposes, eliminate leakages, eliminate corruption in the system, and also improve our efforts towards the fight against HIV and AIDS and other communicable diseases, and also without losing sight of the importance of looking at non-communicable diseases, cancers, and other things like high blood pressure, diabetes, all those things. So I think we need a real look in the whole system so that we say to ourselves, we have moved thus far from 1980. How far are we? Have we improved? And also, our clients must be happy with the services that we are rendering. It's not good enough for us to just say, we've done this, we've done that. We should actually actively seek for feedback from the general populace so that we know whether they're satisfied or not satisfied with the service. So monitoring and evaluation of the system, very important.
Last month we did have on Good Morning Zimbabwe, Dr. Obadiah Moyo, who is the CEO of Chitungwiza Central Hospital. They said that they have started or embarked rather on a joint public-private partnership which has helped spruce up the operations of the hospital. Do you think that is a workable solution, a workable strategy in order to address some of the challenges that most of the modern hospitals are facing?
I think it's a good strategy provided it is done properly, because Chitungwiza Hospital is an outstanding hospital if you compare it to other government hospitals. And the only difference between Chitungwiza and the others is the management that is there. The other hospitals are exposed to the same challenges, but their levels of performance are not at the same level as Chitungwiza. As a result of the way the management there is actually very aggressively implemented these public-private sector partnerships and other innovations. You see, we don't want people who just sit there and wait for intervention from the top. You see, you need innovative leaders at every level who are able to innovate and to respond adequately to the needs of their particular institutions and circumstances.
Okay, but then they still have challenges in order to come to that point.
Yes, challenges will always be there. That's why we put managers in place. Yeah,
so what does
challenges
it
are there
take?
to be overcome.
What kind of a manager does it take to be that kind of a...
It takes somebody who is honest, somebody who is, aggressive in terms of their approach to problem solving, somebody who consults widely so that they come up with the appropriate solutions.
But does the government or does the system allow for the kind of interventions, innovations from the management of a certain hospital?
Yeah, I think it does. I think every manager at every level is given a mandate, and their mandate is to run institutions efficiently within the confines of the law, and be innovative, utilize resources efficiently, eliminate leakages, pilferage, eliminate corruption, reward workers that are performing well, that kind of thing.
Thank you so much for coming to Good Morning Zimbabwe. Former Deputy Health Minister and Surgeon Dr. Edwin Muguti. Today we're talking about the country's health delivery system, which has been cited as being in need of reform. It was going to improve and also realize intended targets. He was giving us a view of some of the areas that need to be looked into as far as the health sector is concerned. And now Good Morning Zimbabwe takes a break.